Hi everyone, welcome to Dermabites with Dr. Viv. I'm Dr. Vivian Oputa. Thanks for joining me today. Today we'll be talking about anti-aging. Now that's a topic that's very important and I'm sure it's a buzzword you've all heard of. But you know what marvels me is that many of my clients and patients are petrified and horrified once they hear that word. They're like, I'm not old, I don't need to be using anti-aging products. But guess what? You should start anti-aging when you hit your 30s. Once you're 30, you go on an anti-aging program to either prevent aging or if there's damage that has been done as a result of assaulting or abusing your skin, then 30 is the best time to start. Now, when you're looking for products to address aging, you should look out for certain ingredients. When it comes to wrinkles, for instance, you should look out for retinols, vitamin C. What vitamin C does, it helps to boost fibroblastic activity, so cells that are produced are healthier. And then with retinol, it speeds up the cell renewal process so that new cells will come to the surface. And in that situation, your skin looks healthier, it looks firmer, it just looks better. Now, if you're somebody who's sagging, maybe because you've been eating the wrong kind of food or you're stretching out your skin, like with the mechanical washing and over, scrubbing your face or eating foods that are destructive, then you need to look for ingredients like peptides and ceramides. With ceramides, those boost the volume of the intracellular water. So cells are, they sort of, they fill up, they're healthier looking. And with that, it helps to smooth out the surface of the skin and add some volume also to the skin. So that is what you should look out for. You should look at, I had mentioned the ingredients before. Now, if you're somebody who has faced hyperpigmentation, which most of us have faced at some point in our lives, especially if you worship the sun, if you're a sun worshiper, please be very careful because hyperpigmentation will be in your future. If you're somebody who picks at your face, if you have scarring or acne, you're just somebody who has used harsh products that have burned your face, you should look out for ingredients like vitamin C. Vitamin C is actually quite effective. It does take a while, and I know a lot of people are so impatient. Just take your time. Time flies so fast. In about 3 months with vitamin C, you should, achieve great results. Then if you need more help, you could use products containing kojic acid, and then of course hydroquinone, which is strictly under medical supervision. So please, make sure you see your dermatologist or your doctor when it comes to dealing with hydroquinone. Now, another one, if you have uneven skin tone, which we've talked about already, you need to use a product containing an alpha hydroxy acid. I'm sure that's something you know about, like the glycolic acid, salicylic acid, beta hydroxy acids, So look out for that ingredient, and then you should also look out for retinoids. Now, retinoids are more like prescription strength versions of the vitamin A. So that should also be used under medical supervision. If you are somebody who has poor lifestyle choices, like you smoke, you drink a lot of alcohol, and then of course you eat junk food, you will now need to take care of these problems. First of all, by stopping these bad habits and then using products that will help to bring your skin back to life, so to speak, because most people who smoke and take a lot of alcohol have very dull, lifeless skin. Now, as we know, smoking in itself prevents your body from absorbing vitamin C that you consume. And then, of course, oxygen carrying capacity is affected, so the oxygenation and detoxification of cells is impaired, and your skin looks terrible. But if you're able to stop these vices, then you will have better skin. Now, you should also look out for you should make sure you get into a good skincare routine, and exfoliation is something that is very important. If your skin is really thick, you may need to see your dermatologist for a chemical peel or any resurfacing procedure. So that would really be helpful when it comes to that. Now, when it comes to these ingredients I've talked about, there are prescription strengths available as well as the over-the-counter strengths. Now, if you're somebody who is a beginner, you might go with the over-the-counter strengths. And if you see product lines with different strengths, start with the lowest strength. for starters, to see how well you tolerate it. If you're able to tolerate it well, then you can now step it up a notch. And if you feel you're not getting enough results or you're not satisfied with the progress, see your dermatologist so they can prescribe prescription care for you, because that will really help. Now, when it comes to skincare, there are certain orders you must adhere to when it comes to application of your products. Of course, you wash your face first, you use a scrub if necessary, and then you also use your toner. You put it on a cotton round, either you dab it all over or you wipe it rigorously. Just look at the instructions. Some of them are even just sprayed on. So look at the instructions and follow them to the letter. Now, what I consider to be the face is your face, your neck, and of course your décolletage, because you have to treat these parts as your face, okay? Now, you want everything to look uniform and nice, and then there are also things to help enhance the way your skin looks. That would be your nutrition. That would be how much sleep you get, the kind of exercise you do. You need aerobic exercise as well as some, strengthening exercises. So all these tie in together to give you the best skin possible. So if you need help or guidance, you can contact me and we will make sure you have the best skin ever. Thank you for listening, and I'll see you again very soon. Stay safe, everyone.